And I need to refer the whole time. So anyway, I'm sorry. Well, I just didn't want all the ringing and everything. If I did that, come over here. Is that even better? Okay. Thanks, Jason. Appreciate it. All right. As Matt mentioned, my name is Clint Kaho. I am president at Baptist Health Grange. I am a Rotarian, but unfortunately, I'm not here to join you very often for a few reasons, but some of those are all of the things that we have going on at Baptist Grange. The growth and development that's going on just takes quite a bit of time. And I'm happy to share a little bit about this with you today. You've probably heard, seen in the news about a few things that we've got going on here today to talk to you a little bit about those, but maybe shed some light on a few other things that we have going on, but maybe talk a little bit about Baptist Health as well. So it said Baptist Health in the OC. I'm going to give you a little bit about Baptist Health in Kentucky and then come back to the OC. So if you have any questions, please stop me along the way. I want to make sure that I'm hitting on what you want to hear about. But if I hit on something you want to hear more about later, if you all would like me to come back, but I don't bore you to sleep today, I'll come back and I'll present on another topic if there's something else you'd like to hear about. But thank you so much for giving me just a few minutes today to share a little bit about the growth and development of healthcare from Baptist Health in our community. So just to start a little bit from the mission. So we exist to demonstrate the love of Christ by providing and coordinating care and improving health in our community. Our vision is that we will lead in clinical excellence, compassionate care, and growth to meet the needs of our patients. And talk about growth in a community like Oldham County that's growing so much. I took this mat on my way over here. I'm driving from the hospital. I took the new Eden Parkway over here. I hopped on Ernie Harris and came over. I saw the exits being worked on. I come down Commerce with the growth and development going on there, and the new Kroger going in, and then I come right on over. So, you know, two new roads, relatively speaking, that brought me here. It's just indicative of the growth that we're having as a community. So therefore, the growth that we need to have for our patients in the community and our citizens. Let me go back for one. And then our values that we try to live and demonstrate every day is integrity, respect, excellence, collaboration, compassion, and joy. Last year, we celebrated Baptist Health in our Oldham County community for 30 years. It was in 1992 that Baptist Health purchased the hospital on New Moody, and we've been here ever since. So we're so thrilled to be a part of our community here, really for longer than 30 years. But ultimately owning the hospital and being the healthcare provider in Oldham County for the past 30 years. In 2024, Baptist Health is going to be celebrating our 100-year anniversary. And we've got a lot of things that we're working on, planning to celebrate with our community, and we'll be celebrating right here in Oldham County as well. So just a little of the history there. When we talk about Baptist and we talk about healthcare in the state of Kentucky, and we're really in southern Indiana as well, when we think about Baptist Health Grange, we think about our hometown community hospital. What many don't realize or think about is that Baptist Health is the largest nonprofit healthcare system in the state of Kentucky, and we have one of those hospitals right here in Oldham County. And so I just bring this along just to share. On a timer or something, but I bring this along just to share a little bit about the service area that we have as Baptist. You can see if it's represented in blue, we consider that a primary service area. In yellow, it's a secondary service area. In orange, that represents our service area in southern Indiana that is covered by our sister hospital, Baptist Health Floyd. And then purple is our service area in southern Illinois, out on the left side of the screen here. Figured it out. On the southern Illinois, and then some one county in Tennessee as well.
we really stretched the state of Kentucky in the services that we're able to provide. Again, what in our community may not realize is the size of scope, the number of services that we provide. So when we look across the state of Kentucky, this does not include our Southern Indiana data. This is Kentucky data that comes from Kentucky Hospital Registry. When we look at the number of open heart surgeries performed in the state of Kentucky, Baptist Health performs more than any other health system. We perform 1 in 5 of the open heart surgeries in the state of Kentucky. We perform 1 in 6 orthopedic surgeries, and we do orthopedic surgery right here in Grange. 1 in 7 ER visits. This is on a timer, I think, and I didn't realize it. 1 in 7 ER visits is done at a Baptist Health emergency department. We have one right here in Grange. 1 in 6 patients, if you're admitted to a hospital, you're going to be admitted to a Baptist Health hospital. 1 in 4 babies are born at a Baptist Health hospital. 1 in 6 outpatient visits across the state of Kentucky are done at a Baptist facility. And 1 in 6 chemotherapy regimens are administered within a Baptist Health facility. And we in LaGrange, we do all of these except for open heart surgeries. We do orthopedic surgery. We have a new emergency department. We obviously admit patients to our inpatient units. We deliver babies. We have many outpatient visits, and we do have a chemotherapy infusion center in LaGrange. One more fact about Baptist Health. We like to say that we have 9 hospitals, 9 nursing excellence designations, and that is 1 world record. So at all of our Baptist Health hospitals, the American Nurses Credentialing Center has an accrediting organization that ultimately awards either a magnet status, and that is a magnet status for our large hospitals. So our Baptist Health Louisville, our Baptist Health Lexington are magnet designated. That's the top award that can be given to a hospital for nursing excellence. And all of the other hospitals are, I tell you, there must be a thing here. I need to keep this thing going, right? It is a less than subtle message. But anyway, we have all of our hospitals are awarded with either the magnet or the pathway designation. And pathway designation is just based on the size of your facility. So we're a pathway designated hospital in LaGrange. It means that we've got the top in nursing care. And we are the only health system in the world, because there are other hospitals in the world that have this designation. Baptist Health is the only health system in the world where all of our hospitals are designated. We're very proud of that. Now, a little bit about what's going on in Oldham County. So a little bit about Baptist Health, Kentucky, now in Oldham County. It's been a busy past year. And I'm going to tell you a little bit about the things that we've announced and done, but I wanted to share that in the last year, we onboarded 7 new providers dedicated to Oldham County that have offices here in Oldham County. You all may be able to challenge me differently, but I've been asking the question, can somebody tell me, how, and thanks for the prompt too, I appreciate that. Could somebody tell me the last time that 7 new providers were dedicated to Oldham County that joined in 1 year? We have OBGYN, we have an orthopedic surgeon, a new neurologist. First time that we've had neurology as outpatient in our community, very important service. Dr. Russell is a family practice physician in a location on Commerce Parkway in Dr. Siddiqui's office. Many of you will know Dr. Siddiqui. Dr. Neff has joined Dr. Karam's practice in Crestwood, and Dr. Manley has joined Dr. Jett's practice in LaGrange. And then we also have Dr. Hopkins, who serves as one of our hospitalists. So if you have that unfortunate event of having to be admitted to the hospital, then you might see Dr. Hopkins as your doctor inside the hospital. In 2022 or 2023, we already have a couple of doctors that are signed on and are coming. We have Dr. Daniel is coming this summer to be another GI physician, gastroenterologist with us. He will join Dr. Overstreet. And then Dr. Bala is our new psychiatrist that is going to be joining. And she's going to serve as the medical director of our new inpatient behavioral health unit that I'm going to talk to you a little bit about here as well, that we are working on too. There we go. Good segue, right? So our plans for behavioral health. We know that mental health and behavioral health needs are unmet right now. There are many more needs that we have in our community that we have access and resources for. We're partnered with the health department and Judge Vogel in working on what can we do as a community, making sure our resources are known. But ultimately, one thing that we know we can do, if I knew how to pause this, I would, and we'd stop this. But one thing that we know we can do is we can expand services on the inpatient front. And we're going to do that through an inpatient behavioral health department. That will be an 11-bed inpatient psychiatry unit. We will locate that in our former skilled and rehab department. If you were familiar with the hospital and knew that we had that service at one time. Our medical group will hire 1.5 physicians to staff the inpatient unit. Dr. Bala is a 1.0. We actually have just made the offer and gotten acceptance of another doctor, so we'll get that part-time position filled as well. We will be having an outpatient behavioral health office in our Medical Park 3. That's in the urgent care building just down the street from us. We will have an outpatient psychiatry office there. And then the medical group, the Baptist Health Medical Group, will hire a team to staff that outpatient office. We plan to open this in May, June timeframe of 2024. We're still working on our plans right now. We've got the approvals for the investments that we need to make to renovate the department. And here I'm just sharing with you a few pictures over here of what this beautiful new inpatient psychiatry department will look like as we renovate that for the future. So we're really excited about this and know this is the service that we need to have for our future. I get lots of questions about what we're doing behind the hospital in LaGrange, and this is our System Pharmacy Services Center. So Baptist Health, as an organization, has scanned the state of Kentucky, looking for a place to put really our system function for pharmacy. This is where all of our medications are going to come in. We'll repackage those, just be ready to distribute those and get them back out to our hospitals and to our care sites. I owe you some happy bucks after this for helping me out here. So this is where we'll bring these medications in. We'll be able to, like I said, repackage and distribute them back out to the hospitals and to the communities where patients where we need to have these services. So we'll be able to have more specialty pharmacy, more availability of medications for our patients in physicians' offices, in our hospitals and otherwise. And so Baptist Health scour everywhere we can locate this, and notice that the growth and development, the opportunity to be able to have this new service center. I'm just going to let it run and then I'll come back to these. To have this new service center being right here in LaGrange is a really great opportunity where we can recruit staff. So this is upwards of potentially 200 new staff members that we'll need when we're fully running. This is a 90,000 square foot facility that is being constructed behind the hospital, and it's about a $40 million investment that we're going to be making into the community for something that we need not only for our patients right here in LaGrange, but throughout the state of Kentucky and Southern Indiana as well. It is really transformative into how we will be providing care, but it's really transformative into our campus as well. If you drive by now, they are starting to remove some of the trees that they need to be able to create the pathway in. And ultimately, if you're heading down New Moody from the stoplight, past the hospital, past Oldham County EMS, and just past that they're starting to clear some trees. That'll be the entrance into the pharmacy service center that will be behind the hospital.
Clint, have you all had your official groundbreaking yet for that?
So yes, so we had an announcement several months ago when it became aware that we were going to be doing this. We've now started breaking the ground and started moving forward. So we really had that public opportunity already. So we're now working on it, and we certainly will do a ribbon cutting when it gets complete. All right.
Sorry.
Are you helping me now?
I'm trying to help you.
Okay.
Not helping, but I'm trying.
Okay, no, that's very good. I do appreciate it. So, we've made announcements about a second healthcare campus, in, Oldham County as well, in Crestwood. Here is just a rendering of what a hospital in Crestwood on this land might look like, and a representation of the campus and what that could potentially look like in Crestwood as well. So this is now, oh, no, that's quite all right. I'm just gonna put this thing down. I'm gonna talk now. So the campus that we're looking at in Crestwood is on the north side of 71, right at exit 14, kind of on the east side of 329. So in that kind of upper right quadrant of the exit there. Ultimately, as we're seeing the growth and development that's going on in our community, we realize that we need to have another location, another site for services. Right now, we are out of space at our Grange Hospital. That's why our outpatient behavioral health department needs to be located down the street from us, because we don't have that space. We have other things that we want to bring onto campus and services that we want to be able to offer right now. But unfortunately, we're just out of space to be able to do that. As we're looking at the growing community as well, diversifying and having another location so we can keep care close to home is an opportunity for us as well. So in the future, what we believe and what we see occurring is we will be developing the campus in Crestwood. We would relocate the hospital, the inpatient services to Crestwood, and then we'd have outpatient services available on both campuses for those services that need to be really closer to home, easily accessible, and locate those really out of convenience for patients to be closer to home. So again, that we announced that last year as well. So all these things, bringing more doctors on, the inpatient psychiatry is something we started dreaming late last year that's going to become a reality for us once we get through the planning process in next year. The pharmacy services center, the Crestwood campus, there's just a lot happening really here throughout Baptist Health, but specifically in Oldham County as well. So one last point that I wanted to make, it's on the next slide. We do all of this ultimately for our patients and for our community, right? It goes back to the mission, vision, values that we have at Baptist Health, is to be able to care for our patients. We want to care for them as convenient and as close to home as we possibly can. And ultimately, this award here is called the Yellow Jersey Award. It is just an internal award within Baptist Health, but I like to share it and show it with you. And if you happen to come to the hospital, to walk in the main entrance and start walking down, the gift shop will be on your left. Right before you get to the gift shop, on the wall is a yellow jersey. And it is kind of modeled off the Tour de France, the yellow jersey, the winner of that race. And ultimately, this is a way for us to go back to our vision of leading in clinical care, is really measuring how are we doing. And we really focus on quality services, we really focus on safety, and we really focus on our patient experience throughout all of Baptist Health. Now, all of our hospitals across the state of Kentucky and Southern Indiana win awards. Some you're going to see are noted as the best hospital as it relates to the U.S. News and World Report and various things like that. Unfortunately, our hospital in Grange, the size of it just isn't sizable enough to even qualify for those types of awards. Although if we did, I'm sure we'd win them. We've got fantastic care, fantastic doctors, fantastic nurses, techs, EVS staff who really, really care about our patients. But when we're able to compare the same metrics around quality, safety, and experience, and compare that across our Baptist Health hospitals, I'm pleased to let you know that the Grange Hospital, our hospital in our community, when it comes to safety, quality, and experience, wins the yellow jersey. And we've won that for the past 3 years. And I'm pleased to tell you the award has been in existence for 3 years. So this is something. Now, we're a competitive group as well. And so we're proud of this. But ultimately, this is the representation of what we provide, the care that we provide for our patients. This comes back to us from those quality outcomes that we have, from the safety and those experiences that our patients have, but ultimately the patient experience with our surveys and various things that come back in terms of the experience that the folks have. So while we have all this growth going on and all this need in our community that we're trying to meet, we never want to lose sight of this opportunity. Whether we win this award next year or not, who knows? But we will always be focused on that quality, safety, and experience in everything that we do. So just want you to think about that. You know, one way that you can help us is in the community when you're hearing about somebody that's in healthcare need, has a need for healthcare. Think of Baptist LaGrange first. We're the community hospital, we're the community provider, and you come to us first. And if we don't have the service, again, when you look at those top services, the only thing that we don't do is open heart surgery. But if we don't have that service, we're networked so tightly into Baptist Louisville that we can get you to those care providers very quickly and conveniently as well. So I will stand and answer any questions. And one question that I have for you all is this what you hope to hear today, or were there some other topics that you wish that I would have brought, and I can try to elaborate on those or come back another time? Yeah.
I just have one quick question. Are you still planning on, from what I understand, keeping an emergency room in LaGrange
Yes.
as well as Crestwood?
Yes.
Okay.
Yeah.
So I get that question a lot, especially in Henry County.
Certainly.
Because it'd be a lot further for them.
Certainly. Yeah. So where we are really with, the question was, are we keeping an emergency department in LaGrange as well as Crestwood? So our vision and our thought is an emergency department is very much primarily an outpatient function. You need it, you're in emergency, you need it close by, you need it close to home. So our vision and our plan is to have the emergency department, which was just recently renovated, and keep that in LaGrange for those purposes, but then have an emergency department with the Crestwood campus as well into the future. We think that we can support both of those. But where we are with the Crestwood campus right now is really wrapping a lot of things up from, zoning and a number of things that are going to need to occur. So this is really a vision for us into the future. And we've got to really sit down and do a lot of strategic planning in terms of what services make sense at what location, for the future. But yeah, emergency departments we see in both.
Did you say that the inpatient in LaGrange will move to the new hospital when it's open? So
Yes,
okay,
that is correct. For inpatient services, we would move those to Crestwood. Thank you. Yeah.
May have missed it, but what is the timeline for completion of the Crestwood campus?
Very good question. There's a lot of work that still has to go into all of this, and ultimately lots of things have to align, from zoning, certificate of need, which is a very good thing, just a process we have to go through in the state of Kentucky. Financial abilities, to create the new healthcare campus, but we're looking really at still about a 5-year timeline. That gives us a couple of years to really sit down and plan exactly what's going to go where, and then a couple of years to construct and be there. So while that is a very exciting opportunity for us into the future, the growth is happening now, and so you're seeing that we're continuing to develop and bring new services onto our LaGrange campus because they're needed for our community, our patients now. Yeah.
I was just curious to know what was the primary factor that led to that being located here.
Are you specifically other locations in Oldham County or throughout the? Yes, yeah. So a number of locations were looked at, but I think Oldham County, having access to easy distribution methods to get around, easy access to 71, to hit the major interstates to deliver throughout, was a factor. Having a campus where we have space and land available for us to build on is another factor. And so it really became, the other thing you have to look at too is, we're going to have a number of staff, and we've got a growing community. in Oldham County. And so it is a place, it's desirable for people to move to raise families and to live in. And so where we need to be able to recruit a number of people, Oldham County is a great place to be. So I think all those factors help to contribute to hating here versus elsewhere. Yeah.
Prior to talking about history, prior to Baptist Hospital coming to Oldham County, our previous hospital was referred to as Mallory Taylor Hospital. And it'd be interesting to see if anyone else besides myself was born in that hospital. Anybody else raise your hand? Born? My wife and myself were both born in Mallory Taylor Hospital. Dr. Walsh, who we've now named Walsh Park there on 4th Street.
Yeah.
He was the main person that delivered all of us. And I actually have his baby scale. I have it in my house right now.
Really?
Yes, I have it, and no telling how many babies that baby scale contribute.
That's really cool.
Yeah.
That is really cool. Yeah.
I want to take this opportunity to thank you, Clint, and your predecessors and the board for helping with the Hope Health Clinic. Without your partnership with the Hope Health Clinic, it would not have been possible. 12 years ago, when we decided to start the clinic, your leadership, you stepped up and provided us space for $1 a year. That has continued. Not only that has continued, but you have provided all sorts of assistance. Some and the other people that have great help to us all along the entire process, especially in the past year and a half as we upgraded to, at your suggestion, sir, upgrade to the newer space with 50% more space. So thank you and your leadership.
The Hope Health Clinic is a wonderful resource for our community, and it's much needed. And through many conversations with Janet, you outgrew the space that we had available. And so the time that we had some additional space that we could give, we're happy to do that. And I did get a tour of it the other day. It is beautiful. On the 28th, you should go over there, get your tour, go to the ribbon cutting, because it is a wonderful resource for the community that many people have put a lot of hard work into. So thank you for those comments, but we are glad to be able to do that. And you mentioned our board as well. I hope it's okay. I'm just going to mention you got a couple of Rotarians in this room that are on the hospital board, and everyone is very supportive. And so I'd like to birthday boy, Mr. Fred Tolsdorf is on our board, as well as Jason Morgan is on our hospital board.
What other questions do we have? I don't want to keep them forever.
I appreciate the time and letting me come. Certainly, if there's topics or things you'd like for me to come back and discuss at a future time, I'm happy to do that as well. So thank you for your time. I appreciate it.
Thank you. He's going to pull a number so we can move on to the next thing. One thing, as you're doing that, Clint, thank you very much for your leadership in the community. Turn that knob you were just had your hand on. No.
Oh,
There we go.
yeah. I'm not a surgeon. I'm not in the OR. I'm not in the. Not worry about that.
No, but seriously, Clint, thank you very much for all that you're doing. It's valuable for us, not only because you're a friend, but because you're a Rotarian and see the value of service in the community. It's huge for us. So thank you very much. Last three of the number today, 920.
It sounds like.
Jane Ashley got excited. Oh. It's Blaine.
Again?
Wow. Again.
Thank you.
Purple, please.
You know the drill, my friend. Good. Oh, all right.
Now you spin.
I'm doing
Robin would say 2 if he hadn't had this left. Pizza, my friend. Thank you very much, everybody, for being here. It's a treasure to be a part of this group. Thank you for all you're doing. Let's go serve somebody today.
There's $60 right there.
This is for you?
Oh, yeah. 2020 and Donna.
Wait.
Yeah.
20 for,
20 for Eric.
yeah, let me get this down here.
Eric Walker. 20 for me.
Eric
Yeah.
Walker,
Yeah.
20. Mike, and that's 20.
Right.
And then a check.
And
for
Donna. Yeah, Donna said.
Think of stand up cash.
Yeah, you said cash or check?
Okay. 20 now.
Sure.
Are you?
Both, yes. And normally we book it from at least 11 until
Perfect.
like 2.
What I was gonna ask you about.
Yeah.
My neighbors, we live on a little street called Green Haven Lane.
Okay.
Almost the one lane road. And the bus.
So I'll bring my iPad out.
Only 35 miles an hour.
That's great.
Yeah,
Yeah, they ought to see you.
I'm not, I'll have to figure out, I don't have.
Most places you can't. Pass. So they
It's
were
okay.
real
When I'll
strict
come
on
early
it.
and if it's something we can sort out, it's
So
fine.
I said,
All right,
well,
second at
I'll
night.
bring it
Yes.
to his attention. I didn't want
Thank
to
you
say
so much, Steve.
No,
You know, but you know who that bus driver is.
I can find out quickly. Well, because I had it happen just in my own development where, guys were, thank you. Guys were, you know, when you go into Crystal Lake, you got that big hill right at the start. Well, you gotta ride the brake all the way in. You know, otherwise you're gonna be going 50 down.
Yeah,
that.
yeah.
And I just named it complaining there, so I know who that driver was. I said, hey, you know, calm it down. Because our deal is, I told him this, I said, we are hiring police to occasionally patrol the neighborhood for speeding. They will be issuing tickets and they will not hesitate to point to a bus driver if you're going 50 down that, you know.
Yeah.
So I like.
Good. Well,
But
if you
Green
don't
Haven-
mind doing that.
Yeah.
I didn't want to hit the big man, but just tell him a friend of yours.
I can take care of that.
Thank you.
Thank
sir.
you. Appreciate it.
Did he hear?
He's got his stuff here, so I guess that would be the case. Get my stuff organized here and turn this off. See you, Billy. Say hi to Billy. He was listening in. Nope, go ahead. Say hi to Billy.
Hello, Billy.
He was able to listen into everything. So, all right, I'm gonna sign off, Billy. Have a good one.